So, good evening, friends. I am Dr. Harivansh Chopra, and I am former professor of community medicine as well as head of the department of community medicine, LLRM Medical College, Meerut. And I had the privilege of holding the post of national president of Indian Association of Preventive and Social Medicine. And I announced this particular competition on World Health Day theme, that is healthy beginning and hopeful future for faculty, postgraduates, and undergraduate students. And we got tremendous response across the country in all the categories. And we have already finished the presentations by the faculty as well as by the postgraduates, which are already there on this particular channel. So if you have not seen, you can see them, and you can subscribe to the channel also. So today we will be having 6 undergraduate students from across the country who will be doing their presentations on World Health Day theme. So we are going to choose 5 out of them for the prizes, but all 6 of them will be getting the certificate of attaining the status of top 6 undergraduate students across the country in this particular competition. So the competition has been very well taken up by the all category of the participants, whether it was faculty, whether it was postgraduates, or whether it is now the turn of undergraduate students. So I wish all of the undergraduates best of luck, and we will be starting with our first presenter. And our first presenter is Dhananjay. Dhananjay, you can start sharing your screen.
Yes, sir. Thank you,
And
sir.
once your screen is there on, then your time will start. You start sharing your screen, Dhananjay. We
Yes,
are
sir.
waiting for you.
Sir, am I audible?
You are audible, but you are not on slideshow. Now, okay. So, Dhananjay, you are on slideshow. Your screen is visible. Now the screen is your and your time starts now.
Thank you, sir. Good evening, respected judges, esteemed faculties, and my dear fellow participants, and all the viewers. Myself, Dhananjay Murmu, a third-year MBBS student from Dharanidhar Medical College and Hospital, Keonzhar, Odisha. Every 2 minutes, somewhere in the world, a newborn baby dies of infection that could have been prevented. Have you ever wondered how something small, uh, invisible microorganisms can infect a baby and can cause death of a newborn baby? Yes, this silent killer is neonatal sepsis. Here are the contents of my presentation. First, we will go for overview, then etiology, classification, major causative pathogens, risk factors, clinical manifestations, diagnostic workup, treatment, prevalence rate and comparison across the region, epidemiological and state data, conclusion and the references. So let's have a look on the neonatal sepsis. Neonatal sepsis is a bloodstream infection. Sorry, sir. Neonatal sepsis is a bloodstream infection in the first 28 days of life, is the leading cause of mortality and morbidity among infants in both developing and developed countries. Developing countries like India. So now let's look at the etiology. The pathogenic organisms from the surroundings enters into the bloodstream of the newborn baby and cause neonatal sepsis, which can cause generalized sepsis or infections like septicemia or localized infections like pneumonia, meningitis, osteomyelitis. Now going towards the classification. Based on the onset, we can classify neonatal sepsis into two categories: early onset sepsis and late onset sepsis. Early onset sepsis occurs within 72 hours of the birth. Majorly, the cause of early onset sepsis are maternal infections. Late onset sepsis. Late onset sepsis generally occurs after 72 hours of the birth. Major causes of the late onset sepsis are environmental infection or community acquired infection. Now, moving on to the causative pathogens, we have gram-negative bacteria like Klebsiella species, most frequently, E. coli, and Acinetobacter sepsis species. Gram-positive bacteria like Staphylococcus aureus, Coagulase-negative Staphylococcus. Fungal pathogens like Candida species also cause neonatal sepsis. High rates of antibiotic resistance, especially among gram-negative organisms, is complicated for the treatment. Now, let's look into the predisposing risk factors. We can categorize the risk factors based on the maternal factors, fetal factors, and environmental factors. Maternal factors like previous baby infected with the gram-negative Staphylococcus or chorioamnitis, rupture of membrane, or multiple vaginal examination. Fetal factors like premature birth, low APGR score, low birth weight are among the major risk factors. Environmental factors like intravenous line insertion, antibiotic use in neonate, and frequent blood samplings. Moving on to the next, clinical manifestations. The clinical manifestations that we generally see in babies are poor feeding, lethargy, poor weight gain, temperature instability like fever or hypothermia, tachycardia, diarrhea, vomiting, feeding intolerance, seizures. These are the common clinical manifestations we can see in babies. Here is the visual representation of all the clinical manifestations. Now, moving on to the diagnostic part, we can have CBC, C-reactive proteins, sampling, blood cultures, lumbar puncture, urine culture in late onsets, and chest X-ray if there is any respiratory symptoms, or blood gas or lactate examination if there is any sign of shock. I want to highlight that blood culture remains the gold standard for the diagnosis of neonatal sepsis. Now, moving on to the neonatal sepsis screen. In neonatal sepsis screen, we have total leukocyte count, absolute neutrophil count, total neutrophil ratio, C-reactive proteins, and micro ESR culture. I have tried to simplify the neonatal sepsis screen and given all the normal range, abnormal range, and what we can suggest if there is any abnormality. I want to highlight that if 2 or more parameters are abnormal, if any symptoms are shown, then we must start the empirical antibiotics. Moving on to the next slide, we have the treatment part. All the treatments shown here are according to the standard treatment guidelines of Odisha 2018. We can classify the treatment based on non-drug treatments or supportive care and drug treatment care or antibiotic care. Non-drug treatment care or supportive care includes hand washing, using clean clothes for the newborn, keeping the baby warm by doing kangaroo mother care, breastfeeding, and if any symptoms of neonatal sepsis is shown, then urgently attend the healthcare facility if any signs of sepsis appears. Now, moving on to the drug treatment. In this table, we can see we have ampicillin and cloxacillin that can be given 50 milligram per kg per dose with the frequency of 12 hours for the baby with age less than 7 days, and for the babies with age more than 7 days, we can give 8-hourly frequency. Then we have gentamicin that can be given 5 milligram per kg per dose. Its frequency remains the same for all the age groups. It is given 24 hours frequency. Then we have second, we have lower dose of cloxacillin, that is 15 milligram per kg per dose. That is given generally 24 hours frequency. All these drugs are given in the IV route, and the duration remains 7 to 10 days. Moving on to the next slide. Here is a summary of the antibiotic treatment for sepsis in young infants. For the baby whose weight is less than 1.5 kg, we give 0.2 ml of gentamicin intramuscular and 1.5 ml of amoxicillin to the baby as syrup. And above 1.5 to 2 kg, we have 0.2 ml gentamicin and 2 ml of amoxicillin. Above 2 kg, between 2 kg to 3 kg, we give 0.3 ml of gentamicin intramuscular and amoxicillin as syrup, 2.5 ml. In between 3 kg to 4 kg baby, we give 0.4 ml of gentamicin intramuscular and 3 ml of amoxicillin syrup. Above 4 to 5 kg, 0.5 ml of gentamicin is given intramuscular and 4 ml of syrup is given. The route of administrations are either intramuscular or oral dose.
Kindly conclude in 1 minute. 9 minutes have gone.
Yes, sir. Prevalence rate across the different regions. We can see the world average is 25 out of 1000, and in developed countries it is significantly lower, like 3 out of 1000. In developing countries it's 30 out of 1000. In India it's 28 out of 1000 live birth. Now epidemiology and state data, neonatal sepsis in India and Odisha. We can say in India it's 30 per thousand live births. In Odisha it's 6.7. Moving on to the different schemes that are run by the state government to fight the neonatal sepsis. We have special newborn care units, home-based newborn cares, Janani Sishu Suraksha Karyakram, Mamta schemes, Lakshya Level Quality Improvement Initiatives, Rashtriya Bal Swasthya Karyakram, and Nirmaya schemes. Now to the conclusions. Neonatal sepsis remains a major public health challenges across the world and in developing countries like India also. So strengthening the health systems, community awareness, and government programs like SNCUs, JSSK, and Mamta schemes are essential for the long-term impact. Thank you, sir, for the opportunity.
Thank you, Dhananjay. You can stop sharing your screen.
Yes.
And thank you for doing a comprehensive presentation on neonatal sepsis. And you have done a very good job. Of course, I will be limiting my comments because of the paucity of time. And I will now request the next speaker, Miss Gauri, to kindly start sharing your screen. Gauri?
Yes, sir. I'm sharing.
Yeah.
Am I audible, sir?
Yeah, you are audible.
Is my screen visible?
Yeah, your screen is visible and you are on slideshow. So your time starts now.
Okay. Thank you, sir. Good evening, everyone. First of all, thank you so much, sir, for giving me this opportunity. I'm Gauri Bule, a second year MBBS student from GMC Akola. Uh, Today, I want to talk about something that all we see but often miss. The title of my presentation is The Voices Unheard, A Journey Through the Adolescent Mental Health. First of all, we see the introduction. Adolescence is a very important stage in our life because it's the time when we all grow emotionally, mentally, and socially. And but it's also a time when many teenagers silently suffers from the mental health issue. Sadly, their struggles are often ignored due to the lack of awareness or the stigma surrounding the mental health. Adolescence is not just about the growing up; it's about the surviving the silent storm. Uh, why focus on the adolescent? Because between this age group, a teenager goes through the massive physical, social, and emotional changes. This period is critical because brain is still developing and the identity is forming. Teenagers today face rising levels of anxiety, depression, even the self-harm. This isn't just happening in a movie or book; it's the reality of many around us. Um, uh, uh, in this, the person which is suffering from the depression often feels like adults don't understand them. Speaking up will make them look so weak. No one really listen them, so they stay silent. Behind a smile, they hide a storm. Many teens are afraid to speak up due to the fear, stigma, and simply because they don't know how to seek for the help. So they silently struggle even when they really needs help. Then some of the most common mental health issues in the adolescent, like the depression, anxiety disorder, eating disorder, ADHD, that is the attention deficit hyperreactivity disorder, self-harm, and the suicidal ideation. These are the signs and symptoms of the depressions, like increase the sadness, can't concentrate, that is the ADHD, then anger issue, and sleep problems. Uh, what are the factors that affects the mental health? There are lots of age specific risk factors that are specific for the particular age group, but we particularly focus on the adults and age group, that is from the 10 to 19 years. what uh, what causes this mental health issue? There are academic pressure, social media, cyberbullying, chasing for the likes, family issue, peer pressure, hormonal changes during the puberty, specifically in the female, that disturbance in the menstrual cycle make them so worried about their reproductive health, and stigma, and most importantly, the lack of emotional support and stigma. All this can lead to the mental uh, mental health issue and the emotional breakdown of the person. Let me share a powerful line that mobile phones or the social media are the silent assassins of the mind. The mobile phones, once the tool of connection, is now a silent killer of mental peace. In the endless scroll, we lost touch with the reality, with others, and eventually with ourselves. They look harmless but constantly affect the teen's confidence, self image, and peace of mind. Uh, Looks for the warning sign that the person suffering from the mental health issue, that the changes in the eating and the sleeping pattern, drops in the school performance, decreased interaction with the family and friends, and then sudden mood changes occur, and being worried and anxious about anything. These are the roughly estimated prevalence data of the mental health issue among the adults and in some of the states of India, according to the study of Global Burden of Disease Study 2021 and NHMS and the Kerala Mental Health Survey and Udaya study. Then what are the reasons for higher mental issue in some of the states? Like in Kerala, we know that the Kerala is also known as the most literate state. That's why there is a academic pressure is intense. So it might be the reason of the cause of mental health issue. And in Tamil Nadu, we see the strong competitive academic environment, need exam pressure. As reported in the news during the COVID pandemic, a number of students in Tamil Nadu sadly took their own lives due to the stress and pressure related to the NEET exam. And suicidal rates are among students are notably high. Um, and also the social media overviews uh, cause the main problem to increase the mental health issue. And then the question arises that how to support the adolescent, and who can support a person going through the depression. Um First of all, like family, friends, social social worker, and uh, the community can help the persons to come out from the depression. And how uh, how could they do that? Like we don't always need to give advice. Sometimes just being there helps a lot. If someone opens up and listen without judgment and say things like that, I am here for you, you are not alone, encourage them to speak to a professional, help them build a healthy routines, and be patient. A little kindness can save a life. The uh, To overcome the depression, a person should try to adopt some healthy habits and positive habits like do exercise regularly, set a healthy sleep routine, socialize regularly with your friends, family, make healthy eating choices, start hobby, keep a gratitude journal. There are some resources also available for the depressed person to overcome the depression, like the national helpline number that I call is available in the all social media handle, and then Asra, Nimhan's helpline, then counseling centers are also available. Then some mental health apps are also available on the Play Store, and the school community programs plays major role to spread awareness among the adults about the mental health. And these are the references I had used for this presentation. And in the end, I want to live with the thought that mental health is just as important as the physical health. Just because teen is smiling doesn't mean they are okay. Let's be the reason someone feels seen, heard, and safe. Let's break the silence around the adults and mental health because every voice matters, especially the unheard ones. That's my thing. Thank you, sir.
Thank you, Gauri, for a wonderful and comprehensive presentation on adolescent mental health. And you have almost covered a lot of things as far as the mental health is concerned. Of course, this is one issue which is neglected in our country. We don't have a
Yes, sir.
comprehensive program for the uh, prevention or treatment of mental health issues of adolescent. Of course, adolescent friendly health centers concept was given by WHO way back, and I remember we did a presentation in probably 2006 in a national level conference, which was a WHO sponsored session where I talked on overview of adolescent, and you can look that presentation. It will be there somewhere on the internet, right? So again,
Yes,
in that I choose the word adolescent, and I made it as an acronym, and then expanded on the word adolescent, and discuss all the problems. And similarly for solutions, again I use the word adolescent, and again made it an acronym, and then explained how by using the acronym we can solve all those problems. Of course, that will be too long if I go into the detail, but yes, you have done a wonderful job, and you have finished your presentation in time also. Thank you so very much. And now we'll be going to our next presenter, that is Kirtan. Kirtan, are you ready? You can start sharing your screen.
Am I audible, sir?
Yeah, you are audible, but you are on slideshow. So your time starts now.
Good evening, everyone, especially Dr. Harivansh Chopra for giving me opportunity to present here. This is my first competition as I am in first year medical student. Myself, Kirtan Bharat Bora, first year medical student of Jeet Medical College and Hospital, Jodhpur from Rajasthan. Today I am here to talk about on the theme healthy beginnings and hopeful futures on World Health Day. World Health Day is celebrated on 7th April every year. It is the beginning of WHO. It was the day on which WHO was abolished. So, sorry, it was the day on which WHO was formed. So, let's say happy birthday WHO. What is the importance of World Health Day? Especially the importance of World Health Day comes, it is a global initiative by WHO to promote awareness and encourage government, organization and individual to address health issues. It's a reminder of collaboration and advocacy are the key of improving health access. This year theme is healthy beginnings and hopeful future. Healthy beginnings are not just the starting of life, it's an intergenerational health. It does not impact an individual, it create a vast impact on the society. They create a ripple effect across generation. Every one of us share a global responsibility to promote health, ensuring the future generation thrives. Healthy beginnings the subtopics can include maternal health, nutrition in life, and vaccination programs. Hopeful futures are the outcomes or results which we can get through, such as commitment to health, intergenerational health benefits, and what we can do. What are the global responsibilities for of every citizen and every countries? Now my topic is maternal health in Rajasthan. As we can see, Rajasthan faces significant challenges, including high maternal mortality rate, inadequate access to a health center, and various initiatives have been taken by the state, which are which shows the result in the table. You can see that Rajasthan has one of the highest maternal mortality ratio in the country, but it is also declining significantly by 28 points from 141 to 113. This is the data of 1719 and 1820. What are the importance of maternal health in communities? Maternal health impact community well-being. It reduces infant mortality. It increases economic growth cooperation. It provides efficiency of health system, intergenerational health benefits, social stability and economic progress, as well as commitment to gender equality. Healthy mother enhance family and social health leads to stronger communities. Current state of maternal health in Rajasthan. Rajasthan faces severe challenges in maternal health due to its because which has high maternal mortality ratio. It is because of social and economic barriers, poverty, illiteracy, and lack of transport hinder access to the healthcare infrastructure. Rajasthan is a cultural hub of India. Many foreign tourists come to visit the culture of Rajasthan, but the culture also brings some obstacles as well as beliefs which are not good for women. Some cultural beliefs prevent women from seeking medical assistance. There are several government healthcare initiatives which are taken, such as Mukhyamantri Chiranjeevi Yojana, which provide financial health assistance to pregnant women, such as National Health Mission, such as Janani Suraksha Yojana, which significantly boost institutional deliveries among women. What Rajasthan does to reduce maternal mortality ratio or increase maternal health? It focuses on safe deliveries, ensure transportation for every expected mother, and it increases skill birth attendance. What are the role of NGO in maternal health? NGO plays an important role in spreading awareness, especially educating rural women, conducting nutritional workshop, and collaborating with the government to extend maternal services. Community involvement is very important in mental health. Role of local leaders such as ASHA workers and village sarpanch is very important as they educate the families. ASHA worker help the families through the government policies. Community involvement engages the impoverished and illiterate and tells them about the benefit of the government policies as well as empowerment through education. What are the challenges which comes in direction of maternal health, such as underreporting of maternal deaths, especially by government employees by mistake or which focuses their promotion task. Geographical disparities. Rural areas faces significant limitations, especially in Rajasthan, because of desert, sand dunes, loo, which we can see temperature differences, lack of water shortages, etc. Health worker shortages, specifically rural and urban differences. There is very high number of health workers in urban area, but there are significantly low or nil workers in the rural areas. And enhancing maternal health in Rajasthan is an outcome of a multifaceted approach of the government as well as NGOs, community involvement, as government provides for sufficient fund for healthcare infrastructure, local leaders and ASHA workers, as well as community spread awareness, and NGO conduct nutrition as well as extra camps which improves their mental education and etc. What are the future direction in mental health? The future direction we can focus on strengthening infrastructure, such as infrastructure in rural areas, training healthcare workers, focusing on reducing healthcare workers or making urban areas normal and increasing the healthcare workers in rural areas. Expanding telemedicine, that is digital medicine. It is a branch of medicine which focuses on online mediums to reduce geographical barriers. What is the role of medical committee? We, as future doctors, can play a significant role in health policies. I learned a line from Dr. Chopra that passion, politics, and policies play a key role in community medicine. If we are passionate, we can promote policies and impact politics for advanced health policies, research and innovation, ground level research, especially in pediatrics and maternal health, leads to improved treatment as well as health outcome for future generation. Community outreach. The medical students as well as other medical related professionals, especially medical students during the family adoption program, visit different villages which provide them with health access as well as which empower them, and which give them knowledge about different policies and different outcomes of their problems. We, the future doctors, can promote lifelong health by focusing on health education, community involvement, as well as policy development. Now, I would like to conclude myself with a line: let's play our part in promoting health, supporting policies, and investing in future generation. Together, we can ensure every child and mother has a better and healthier future. Thank you.
Thank you, Dr. Kirtan, and you can stop sharing your screen. Yeah, and you have finished it in time. That is point number one. Point number two, you have taken the help of AI for making this presentation, and that
Yes.
is why you have not been able to change what I suggested you in the rehearsal. So you have to understand yet that you can take the help of AI, but ultimately it is you who is going to modify the presentation, and you have to learn that particular art. Of course, you have listened to the previous presentation, so that is why you were able to remember the 3 Ps, that is passion, politics, and what was the third one?
Policies.
Policy. So, right. So you have to have the passion to work in the field. That is very, very important. And yes, once you are able to work in the field, then you can plan certain studies, you can generate the evidence. And once the evidence is there, only then you can promote it for change in the policy or in policy formulation. But end of the day, it is the politician who decide everything. And I'll share one little story with all of you, and it will be on record. It is going on record. In 2007, probably, I was approached by Ministry of Health and Family Welfare for making certain technical recommendations on urban health. All of you remember that first the Rural Health Mission was launched, and then the National Health Mission was launched. So at that particular point of time, we prepared a document on primary urban health centers, and we worked very, very hard, right? And our task was to design the infrastructure and logistics and all the material which will be needed to run that urban primary health center, and what will be the staffing requirement and other things. So since I was working in the urban area for last more than 2 decades, I was also invited as an expert, and all those recommendations were made. And we used to have regular meetings in Nirman Bhavan with one of the joint secretary of health as well as with one deputy secretary. I still remember their name. Mr. Amit Mohan Prasad was the joint secretary who was looking after the urban health at that particular point of time. And I think we had 10, 12 meetings, and we took a lot of time to prepare a particular document, right? At that particular point of time, when that document ultimately reached to the health minister, so health minister then refused to accept that document, saying that we don't have doctors, so we can't implement it. So that is why I say that 3 things are important: passion, politics, and
Policy.
These 3 are important. Once you work, because we were working in an urban health center for more than 2 decades, so we have all the insights, what kind of problems are there and how those problems can be solved. But yes, we were able to generate the evidence because there were a lot of people across the country. And I remember a few IAS from Karnataka and Maharashtra also attended a few of those meetings, because Karnataka and Maharashtra were running urban health centers in their states. Because India is a huge country, and it is very, very difficult to have a uniform policy, because ultimately health is the responsibility of the state government, right? Health is the responsibility of the state government. So then what happened that the recommendations were put into a Thandavasta, basically, and nothing happened for another 5 years. So you'll have to understand that if you are not able to sensitize the politician, then whatever you do, public health is all politics, because ultimately all the money will come through the politician. That is important to understand. And once you understand right from the beginning, and you are in first year, you have a long, long way to go forward. But then you must also understand that using technology and having mastery over the technology, Because if you are not able to modify your presentation, your fonts are very small, and I doubt that those who are watching on YouTube will be able to see what is written in your presentation. I was not interested in talking about the presentation, but then since you said, and a lot of people said that, yes, people are using the AI. So I myself use AI for my presentations, but now I modify them accordingly. And
I
you
was
have
able
to
to
have.
modify, but I thought that it was not looking good. For I think if the presentation is attractive, then the students or people will focus, and then they will learn something or they will read. If the presentation is not attractive, they will not only focus.
Okay. Both the things are there. You must understand that there
Yes,
are two things which all of you must understand. You see, no aid can make you a good presenter. Presentation is an art, teaching is an art. So if you are confident, right? So only then, and if you remember the content by heart, only then you will be able to do a good presentation. Otherwise, you are just reading from your PowerPoint, and then it is not going to be as effective as you wish it to be. That is important. But still, it's a learning days. I accept, if I would have been at your place in first year, probably I would not have the courage to give the entry and participate. So I congratulate all of you that you are in the formative years of your MBBS, and you have made these good presentation. Presentation is good, but then you must understand that what is the importance of font? Because if your fonts are small, you see your slide is there for 30 seconds because you are changing it. So people will not be able to read if they are using it on their mobile. That is why we gave certain guidelines in the Google form which are to be followed. Anyway, good presentation and all the best to you. Now we will move forward to the next presenter, and Puneet, you can start sharing your screen.
Thank you, sir. Thank you for the teaching.
I'm audible, sir.
Yeah,
My
it
presentation
is not on
visible?
slideshow. Yeah, it is visible, and your time starts now.
Okay, sir. Good evening, sir. My name is Puneet Pandey. I'm pursuing my MBS from Government Medical College, Jalore. I present my thanks for giving this opportunity. I present my presentation on World Health Day. Topic is maternal health. The theme for 1915 is Know Your Health and Services, and theme for 2025 is Healthy Beginning of Your Futures. The introduction of the WHO is every year we celebrate on April 17. April 17 is stabilized by the World Health Organization. Purpose is the awareness on the global health issues. Why we focus on maternal health? Why we focus on maternal health? The key indicator of a healthy society, children and the families. Challenges is India, especially in UP. I belong to the UP, especially in the UP. The aligned with the SDG3, good health and well-beings. The maternal mortality rate in UP is about 167 deaths per 1 lakh live births. 59% of women receive full antenatal care. Institutional delivery is about 79%, and the anemic in pregnancy women is over 50%. How much the women weight increased during the pregnancy in Uttar Pradesh, about 30 to 80 kg in the normal weight gain for the women with low BMI. The largest state by the population of UP is the largest state of population, high maternal mortality rate ratio, challenges lack of access to quality health care, poor nutrition and anemia. The pie chart that represent the diseases or causes, the hemorrhagic about 27%, eclampsia about 20%, obstructed liver about 10%, sepsis about 24%, anemia about 8%, and indirect causes like HIV, tuberculosis, malaria is about 11%. The government initiatives in Uttar Pradesh about the government initiative like Janani Suraksha Yojana, Pradhan Mantri Matru Vandana Yojana, Mission Shakti, or I think everyone knows about 102 and 108 ambulance services, and Kalya program. The shortage of the healthcare challenges, the shortage of the healthcare professionals, rural access issues, low awareness and educations, cultural taboos and superstitions, and poor center infrastructures. The graph that represent the maternal mortality rate in the Uttar Pradesh, about 258, and on the top is Assam, Bihar, after that UP. The strength, how we improved this, the strength ASA, ANMs, improve nutrition, supplement distributions, increase awareness through outreach, upgrade rural healthcare, and public-private partnership. The increase awareness through outreaches, upgrade rural healthcare, public-private partnerships. The role of society and the youth, promote awareness, voluntary health campaign, support maternal nutrition programs, break myths and stigmas. And this is the maternal mortality landscape, account for 22% of India's, UP is 22% of India's death. The eastern region faces higher risk. Many deaths are preventable. Strategies focus on solution for these high-risk zones. High-risk zone, Eastern UP about 573 deaths per 1 lakh birth. Adolescent maternal health, young mothers faces the highest risks. Children marriage compound the issues. The prenatal care SS2 often limit focus on the education and prevention. Age group about 15 to 19, highest risk. This is the scheme that initiated by the government, like Sukanya Smriti scheme for adolescent girl, Pushan Abhiyan, NSIGSE scheme for the promotion of menstruational hygiene, Mission Vatsalya scheme, Udhan, and Beti Bachao, Beti Padhao. The pregnant women apply for the Pradhan Mantri Mrityu Vandana Yojana benefits. About in Himachal Pradesh about 50%, and in the Chhattisgarh about 28%. In Madhya Pradesh almost same as Chhattisgarh, and in Odisha almost 78 or 80%, and Uttar Pradesh about 28%. The budget given by the government, the graph that represents the budget in the financial year 13 to financial 2025. My conclusion on this topic: the maternal healthcare is crucial for the for UP's collective efforts are essential. World Health Day reminds us to prioritize mothers, healthy mother, healthy family, healthy nation. Thank you very much.
Thank you, Puneet, for highlighting the problem faced by the mothers in UP. Of course, UP is one of the largest state as far as the population is concerned. And yes, definitely, UP has to go a long way if you have to achieve the SDG goals by 2030. And UP will be the major contributor in that. And as a undergraduate students, it is important for all of you to understand that until and unless we are able to control the population growth in our country, we will not be able in a position to provide quality health services to all the beneficiaries. Because you must understand, budget constraints are always there and health is never a priority. World Health Organization has recommended that 5% of GDP must be allocated to health, right? But we are far, far away from that figure. We are not even able to provide 50%. But then you have to remember, it is not the provision. Even when we are able to provide, say, 2% of GDP for health, that 2% is not fully utilized. So that is again a problem, because if you are getting the money and you are not able to utilize the money, that is also a big issue. And it is a constitutional mandate that the state has to provide assistance to the vulnerable population, and mother and children are considered to be the vulnerable population in any country, especially in India. And that is why all these schemes are running. We have come a long, long way from the previous time, right? And mortality has also increased, the morbidity is also decreasing. But again, we need to have a focused approach, right? And there are a lot of changes which are required in the healthcare delivery system, because ultimately it is the healthcare delivery system which is responsible for delivering all kind of care, irrespective of the availability of the budget or no budget. If healthcare delivery personnel are not there, then what can be done? So that needs to change. We have a centralized system of providing the healthcare delivery. Till we go down to local level, until we are able to, what we say, bring changes at that particular point, only then, because appointments are done at central level in every state, they are not done at the district level, right? So from district to sub district level, because ultimately majority of the population in India, and especially in state like Madhya Pradesh, Bihar, Rajasthan, and UP, they live in the rural areas. And health services in the rural area, they need a drastic improvement. They need a drastic improvement. So this is just giving you the basic idea how the health services are being provided in our country, and what lacunas are there, and what changes can be brought about. And I hope that with people like you who are very enthusiastic and passionate about all these things, we will see a lot of changes. Thank you very much for your presentation. So
Thank you,
we
sir.
now will be moving forward to the next presenter, and next presenter is Shreya. So Shreya, you can start sharing your screen.
Thank you, sir. Sir, is it visible?
Yeah, you are on slideshow and your time starts now.
Okay, sir. Good evening, everyone. I am Shreya Srivastava, an MBBS student from ASMC Shahjahanpur. Today, I will be presenting on a topic that lies at the very heart of public health, maternal health. Every life begins with a mother, but not every mother survives to see her child grow. Every year, hundreds and thousands of women across the world dies due to complications related to pregnancy and childbirth, where most of these complications are actually preventable. This seminar is not just a discussion, it's a call to take action to protect the health, rights, and dignity of every mother everywhere. We will begin with an introduction to maternal health, followed by its burden in India, key determinants, national programs, role of community medicine. We will also touch on the challenges we face and explore innovative solutions. Now, what is maternal health? As defined by WHO, it is health of women during pregnancy, childbirth, and postpartum. It not only includes physical health, but also mental, social, and emotional well-being. Maternal mortality ratio. Maternal mortality ratio refers to the number of women who died due to pregnancy-related causes per 1 lakh live births. This graph illustrates global disparities in maternal mortality ratio across different nations of the world. Here we can say Sub-Saharan Africa remains the region with highest MMR, with rates much higher than the global average, whereas high-income countries have much lower MMR with an average around 11 deaths per 1 lakh live births. This map illustrates regional disparities in MMR across different Indian states. Here we can say states like Kerala, Tamil Nadu, and Maharashtra have much lower MMR, whereas states like Uttar Pradesh and Assam have much higher MMR. This map highlights the importance of regional efforts. Determinants of maternal health. There are several factors which influence maternal health. Now let's discuss them in detail. Biological factors. Age. Age at which a woman becomes pregnant plays a crucial role. Teenage pregnancies are often associated with high risk of complications such as preterm birth and low birth weight baby. Whereas on the other hand, pregnancies after 35 years of age are also at high risk due to reduced fertility and increased chances of C-section delivery and higher chances of pregnancy-related complications like hypertension and diabetes. Parity means number of previous births. Primary paras are first-time mothers often suffer longer labor and higher anxiety levels, which can complicate the delivery process. And grand multiparas are also at high risk of uterine rupture and postpartum hemorrhage. Pre-existing conditions like heart diseases, anemia, hypertension, diabetes, if not managed properly, can lead to poor maternal outcomes such as stillbirth, miscarriage, and maternal mortality. Socioeconomic factors: women from low socioeconomic background often face poor nutrition, poor living conditions, and inadequate access to healthcare facilities. Education also plays a major role, as educated women are more likely to make informed decisions and they have better access to healthcare facilities. Healthcare system, weak referral system, shortage of skilled professionals, and lack of funding can complicate the care process. Cultural and geographical barriers. Cultural barriers: there are some cultures in which there is provision of early marriage and much more reliance on traditional birth assistant without formal training, and these cultures can put mothers at risk. Geographical barriers: women from rural and remote areas often face longer distances to the nearest health facility and shortage of skilled professionals, and also poor transport infrastructure. Urban slums also face challenges like poor sanitation and overcrowding, which adversely affect the maternal health. Now, what is maternal death? Death of a female due to pregnancy are related causes within 42 days of delivery, not included clauses like accidents, trauma, and electrocution. Causes of maternal death: there can be direct causes and indirect causes. Indirect causes: most common causes postpartum hemorrhage followed by hypertension, sepsis, abortion, obstructed labor. In indirect cause, most common cause is anemia followed by malaria and heart disease. Now, what are the preventive and curative services available to improve maternal health? Antenatal care: early registration of pregnancy within 12 weeks, regular and minimum 4 antenatal visits for routine checkups and for routine screening of torch infections, hypertension, and diabetes, and administration of tetanus toxoids and iron folic acid supplementation. Institutional delivery: promoting institutional delivery through incentive-based schemes such as Janani Suraksha Yojana and provision of emergency obstetric care to manage complications. Postnatal checkups: regular postnatal visits, monitoring signs for postpartum depression, bleeding and infection, counseling on breastfeeding, immunization, newborn care, and family planning. Nutrition and anemia prevention, iron folic acid supplementation, and for nutrition, there is counseling on improving nutrition during pregnancy as per recommended daily allowance. This graph shows how can we access better pregnancy outcomes through mobilization of community health workers such as ASHA worker, ANMs, and village health activists, antenatal care, early detection of danger signs, and early management of complications and safe delivery. We can get better pregnancy outcomes. Now, what are the government schemes available? Janani Suraksha Yojana, its objective is to promote institutional delivery based on incentive schemes. In high-performing states, incentive given to mother is 700 in rural areas and 600 in urban areas. And in low-performing states, for mothers, it is 1400 in rural areas and 1000 in urban areas. And for ASHA workers, it is 600 in urban areas and 400 in rural areas in both low and high-performing states. These incentives are available up to 2 live births. Pradhan Mantri Surakshit Matrit Abhiyan. Under this program, there is screening of pregnant female under free ANC checkups on 9th of every month. Laksh initiatives: it comes under National Quality Assurance Program, and its objective is to improve quality of labor rooms. RM and CHA approach: it is a comprehensive reproductive health strategy which covers reproductive health, maternal, newborn, child, and adolescent health and nutrition. Role of ASHAs and ANMs. Role of ASHA worker: counseling. She counsel the mother regarding importance of safe delivery, breastfeeding, immunization, and contraception. Community sensitization: she spread awareness regarding health, nutrition, sanitation, and health-related programs. She provide primary treatment for minor ailments like malaria, diarrhea, fever, and also provide medicines under DOTS program. Community mobilization: she increases participation in community-related health programs. Survey of health and related events. She escort the pregnant female to the nearest health facility for antenatal and postnatal checkup and for institutional delivery. Challenges we face in India: disparities in rural and urban areas, delay in care model, 3 care model, shortage of skilled birth attendants, lack of awareness, and high adolescent pregnancy rate. What is 3 delay model? It is a framework to understand the factors contributing to poor maternal outcomes and maternal mortality due to socio-cultural factors and delayed access to health facility and quality of care. There are 3 delays in care seeking process. First delay is delay to seek care, and it results in delayed recognition of complications, resulting in increased risk of life-threatening condition. Second delay is delay in identifying and reaching health facility. It increases time taken in education, women health facility, and she may not get the appropriate treatment, which can lead to preventable complications and death. Addressing all these 3 delays through community education, health infrastructure, transport facility, and quality of care, we can significantly improve the maternal health. Now, what are the innovative solutions and way forward? Strengthening referral transport. 102 ambulance services is a non-emergency transport facility available especially for pregnant women, postnatal mothers, and newborn. 108 service is an emergency ambulance service for all citizens of India. Promoting telemedicine and digital marketing. Telemedicine bridges gap in access by providing remote consultation, continuation of care by video calls, and digital tracking provide targeted and timely treatment through real-time monitoring and automated reminders. Together, both these telemedicine and digital tracking reduces the first and second delay in 3-delay model. Women empowerment allows women to exercise autonomy and make informed decisions, access healthcare facility, and advocate their well-being. Community-based health insurance, it empowers family and connect them to health services and bridges the gap left by facility-based care. Now, we can see that maternal health is not just a medical issue, it is a social responsibility. And by investing in maternal health, we are investing in stronger families, healthier children, and more resilient community. Let's commit ourselves to ensure that no mother loses her life while giving a life. Thank you.
Thank you, Shreya. Thank you, Shreya, for a wonderful and effective presentation on maternal health, where you highlighted the determinants of health as well as you highlighted the 3 Ds, that is the delays, which are responsible for mortality. And majority of time we concentrate on mortality. But as a teacher of preventive medicine, I can tell you that all these things are preventable. And all these morbidities, except the medical conditions which are there, like hypertension, if it is primary in nature or idiopathic, then we can't help it. But rest of the conditions are mainly preventable. And when we say prevention, it is not only primary prevention, the secondary prevention is also part of the prevention. So if the treatment is given in time, that is also important. And if you can manage all those things, but then again, yes, it needs the total understanding of the problem. And then you have to prioritize what action can be taken at the local level. That is important. WHO gives the theme, but WHO does not wishes that all the solutions should come from the WHO headquarters. People have to think what are the local issues and what are the local facilities which are available by which that these preventive measures can be taken up. So once again, my congratulations to you for doing a wonderful presentation, and that too finishing just in the nick of time. And it shows that you have practiced a lot as far as this particular presentation is concerned. So my congratulations to you, and thank you very much. And we can talk about it for hours together, maternal health and child health, which has been my domain for more than 3 decades or so. But then for the paucity of time, I will not be. I am just giving you some inputs based on my experiences. Yes, you also highlighted, the previous speaker also highlighted the problem of teenage pregnancies. Of course, there is a law which states that you can't get married below the age of 18 years. But every law is not implemented. Similarly, on paper, we say we are providing services. But in reality, what is the provision? That you have to see that for that you have to go to the rural areas, you have to go to the centers, you have to interview the ANMs, you have to interview the Anganwadi workers, and then your insight will be different. What is written in paper and what is practiced in the field is entirely a different cup of tea or different phenomena, right? So my request is that do go to these places, do interview, do interact with these people, these workers, and only then you will come to know the reality, what kind of services are being provided, whether they are provided on paper or whether they are provided in reality, whether they are quantitative in nature or whether they are qualitative in nature, right? That is again important because we are talking of quality of care. And once we say quality of care, then the care which is to be provided in a manner, in a manner in which it should be provided is known as the quality, right? So at right time, at right place, if it is provided, then we say it is a quality services. So those things need a lot of observation. And once you start observation, then you can plan certain studies. And once you are able to plan certain studies, of course, it is beyond the scope of your understanding right now what kind of studies can be planned, as you will learn through your career the research methodologies and research methods, how the studies are done, and then you can generate the evidence. You see, personal experience has a value in teaching, but personal experience has no value in making the policies. Because the policymakers, they look for evidence, and evidence for them is something which is published, right? So that is again a key point which all of you must understand, that whatsoever observations you are making, you have to bring it down in the paper. And if you are able to publish that, only then probably your recommendations will be accepted. Thank you so very much for doing a wonderful presentation. And with this, we now come to our last participant, Mr. Yash. Kindly start sharing your screen.
Good evening, everyone. Myself, Yash Damani. I'm here to present the topic neonatal health, titled Healthy Beginning and Hopeful Future. We often assume that the moment a baby is born, the hardest part is over. But in reality, the first 28 days of life are the most critical. These early days shape a child's entire future. And unfortunately, this is when the highest risk of death occurs. This presentation explores where we stand, what's working, and how we can do better to ensure every newborn has a healthy start and hopeful future. Let's look at the numbers. Maharashtra's neonatal mortality rate is 11 per 1,000 live births. That's better than the national average of 20. And yes, we have met the Sustainable Development Goal target. But numbers alone don't tell the full story. Behind every data point is a newborn who could thrive if given the right start. The leading cause of neonatal deaths in our state are infection, birth asphyxia, and prematurity. All of these are preventable if we act on time and act right. Now, what fuels these outcomes? Maternal anemia, poor antenatal care, home births without skilled help, and lack of hygiene and awareness. Improving neonatal health means addressing these root causes, especially among the underserved. We still face system-level challenges, not enough trained professionals, weak referral systems, gaps in follow-up care, and shortage of quality newborn care units. Even one weak link can cost a life. Thankfully, several government initiatives are at work. The national programs include facility-based newborn care, India Newborn Action Plan, Janani Suraksha Yojana, home-based newborn care, and Janani Sishu Suraksha Karyakram. There are many Maharashtra government initiatives like Pradhan Mantri Maitritva Suraksha Abhiyan, Manav Vikas Camp for maternal and child health. Special newborn care units are established in many districts of the Maharashtra. Community health workers are also involved. This need better funding, monitoring, and reach. Let's take a success story. In Sargana block, local teams amplified existing programs and saw major improvements in both maternal and newborn outcomes. This is proof that targeted localized action works and can be replicated. Moving on to next topic, kangaroo mother care. One small intervention that saves lives is kangaroo mother care. The main aim is skin-to-skin contact. It prevents hypothermia, improves bonding between mother and child, and is low cost and scalable even in rural facilities. Every health center should promote this. Technological interventions. Modern problems require modern solutions, like digital tracking of newborns, tele-NICU support, AI-based risk screening, and real-time alerts for birth complications. Tech can help us bridge rural and urban gaps in neonatal care. The main key challenges are, which we still have to overcome, post-discharge care gaps and lack of family education. So to overcome those, what we need is better SNCU quality, rural birth attendant training, stronger referral and transport chains, and digital tracking for high-risk newborns. A healthy mother means a healthy neonate. High-quality antenatal care like giving iron, folic acid, and tetanus protection is non-negotiable. Integrated services all under one roof creates seamless care. There are many proposed models to prevent this. Few of those are integrating village health with NSU link, ASHA workers with mobile alerts, mobile neonatal care units, and monthly home visits. This model is not futuristic. It's possible now with the right investment. The impacted projections are, what if we reduce the NMR by just 1 per 1,000? We will save 2,000 newborn lives annually in Maharashtra alone. That's fewer hospitalizations, fewer complications, and less emotional and economic burden on the families. Several common myths surround neonatal care, such as it's not necessary to bathe a newborn immediately after birth, apply kajal to their eyes, massage them with mustard oil, or avoid breastfeeding if the mother has cold. But few of those are discussed here. Newborns don't need immediate breastfeeding, but in fact, early breastfeeding within first 3 hours boosts immunity. Vaccinations can be delayed without harm. That's a myth. The actual fact is timely immunization is essential. The references were from WHO Maharashtra Initiative, State Health Department of Maharashtra, NFHS 5 Maharashtra Report, and SRS 2020. Thank you for your time. Let's remember, healthy newborns make a hopeful nation. Every life saved today means a stronger tomorrow. Let's commit to nurture, to act, and to lead. Thank you.
Thank you, Yash. You can stop sharing your screen. Thank you, Yash, for a excellent presentation. Why I'm saying excellent presentation, because I think you have followed all the guidelines which were given in the Google form, and your slides were exceptionally good, visible, and impactful.
Thank you, sir.
And that again is important to understand, that if you put too much of material in one slide, the slide does not becomes effective. It should be less material. And that is why we gave you the guidelines that there should not be more than 4 lines, and each line should not have more than 4 words, and it should be coupled with images. So you have made a wonderful presentation. I can tell you that we have finished with the postgraduate and faculty presentation. Your presentation will be one of the best amongst all the categories.
Thank you,
So
sir.
my congratulations to you for making such a good presentation. So it is important to make a good presentation. Not only make a good presentation, understand the presentation and then deliver it effectively. And that makes you a better presenter in both the aspects, as far as your content is concerned and as far as your delivery is concerned. So my congratulations to all of you. I understand it is difficult, and especially majority of you might be doing it for the first time on Zoom, or maybe may have done it previously, but you are live on YouTube and your presentations are going to be there forever. So you can yourself can see, and you can compare your each other presentation and can decide which presentation is the best, because now it is there in the digital format for times to come. So this was a wonderful opportunity. Those who could not join, they have missed the opportunity. We can feel sorry for them, can't do much for them. Yes, with this, we come to the end of this particular category of competition. So what I'll be doing now, I'll be stopping the live presentation and then we'll be interacting on Zoom. So thank you very much, viewers, for bearing with us and listening to the young minds in India who are the budding doctors, but they still feel how the health problems of mother and child can be solved, can be managed, and can be prevented at the most peripheral level of care. So, if that is their thinking, I think the medical field is in right hands, and these people will definitely work passionately in the field of public health and bring about important policy changes which are badly needed in every country, and in a country like India especially we need lot of innovations and we need lot of local solutions which the people living in the different states, region, cities and villages can themselves provide, and this will help them also because this will give them satisfaction, and this will help the country also because it will help the country to become a better place for living. Because if health is good, then you see the happiness index is also good, and if you are healthy, then there are high chances that you are mentally healthy also. If your physical health is good, your mental health is always good. So all these things are interrelated, complex, and if you are able to provide relief and benefit to the community, that could be one ultimate purpose of your life, which will make you happy and healthy. So, with these words, we finish our presentation here, and we will be meeting soon once again with another set of program. Thank you very much for giving your